Good morning, everybody. Today we are here in Jumla district to present the mental health and psychosocial support for COVID-19. Especially, it is the presentation prepared by Mr. Ramar, Partha, Karthik to present to the class. Mr. Ramar Partha Karthik is a well-known psychotherapist, neurotherapy trainer, curriculum coordinator, and a very enthusiastic and young guy. Due to the lack of some network problems and the net here in Joomla, we are presenting earlier, but we are unable to present this presentation through the Zoom, so we are going to make video earlier, and we are keeping this video after in YouTube. Without delaying, I'd like to welcome Mr. Ramar Partha Karthik. So good morning.
Good morning.
Welcome. Can you tell something about yourself?
Yes, I am Ramar Partha Karthik. My name is simply called Karthik. So I studied MSc Counseling Psychotherapist, as well as I am doing a clinical psychologist as well as a naturopathic trainer. And presently I am giving the curriculum coordination as well as counselor to the schools and boarding schools as well as academy, college, university. These are the works I am doing. Thanks to COVOD, because this time they're doing so much of medical wise research as well as the service. So there was my opportunity to share my experience and views about this the pandemic situation. Yeah, thank you so much.
So shall we start questioning?
Yeah, please carry on the questions.
Then, at first I would like to ask you the question, what is mental health in your opinion?
Mental health is like a state of mind. What is my mind? And according to the environment, the state of mind, and it means my state of mind, certain situation I am feeling. Maybe the I feeling the worry situation, maybe crisis situation, maybe it's maybe a natural disaster, or normal situation. I'm just happy with my family members, community. So this is a state of mind. And how I'm looking at things, actually, it means how I'm perceiving things the surrounding environment. So this is the state of mental health, actually. That's nothing beyond that.
Well answered. Thank you. And it is so. Then what do you think good mental health and bad?
There is not like a good mental health and bad mental health. Maybe mental health level is, maybe we can say, my happiness level, my peaceful level, and my equanimous of the mind. That level is changing every time. So that may be the level of the mental health. We cannot say good mental health and bad mental health. We can say some kind of depression and some kind of phobia, some kind of psychosomatic related things we can say. And for this, maybe for the mental health, you are saying the health is the medical professional field. If you want to say something more, if imbalance of my mind is imbalanced, so what will happen? It will create some biochemical secretion in every part of the organ. If example, I get anger, some kind of bile juice can produce. Sometimes my pituitary gland will produce certain things. So due to this pituitary gland secretion, this biochemical changes, this will affect my sleeping disturbance, and sometimes I feel dementia. Some different psychological disorders will happen. So these are the reason for the mental health is one of the important scenario the present modern day life.
Okay. And then psychosocial support means?
It is I can say psycho means I can saying it's the same like mind. It's a state of mind and understanding the problem by exact in the psychological point of view. It's like a scientific way you can understand what is the cause and relationship. Suppose I have some problem with my family. So what is the way I perceived the issues, and what is the cause of the problem, and how I am reacting to the problem? That is important. So in this social means we know all very well, and that was the community, family, peer groups, and relationship, organization, institutions, and many things. So these all are the things will influence our everyday life. So if you want to go further support, so whether my community is giving the positive support, otherwise my community is withdrawing, my family is giving the positive support, otherwise withdrawing, maybe institution or organization, even medical professionals, they are giving the positive support, or maybe prejudice. So these are the things for the psychosocial support. And especially for COVID-19, this is our title of the topic. And it's for COVID-19, it's like providing the WHO given one of the important program that is called mental health psychosocial support. It's one kind of program. It's implementing by all part of the nation. So it's now the CAHS also is started doing that work. So I thanks to CAHS this moment actually. Yeah, please.
You recently tell us about the MHPSS, mental health psycho support. So, what is the MHPSS? Can you clear it? And what role can do for COVID-19, especially Nepal and the remote area like Jumla? No?
Okay, and MHPSS is first of all is adopted by World Health Organization. So it's called mental health and psychosocial support. That was they're giving certain importance to the communities. And now the virus is spreading and something is happening in our place. So how the community and the group of population, how they're reacting. So once the reaction about Jumla, so before we need to understanding about the epidemic, endemic and pandemic. So epidemic means this is one particular region. Endemic, it will be particular continent wise, like that we can say. And pandemic means it's a completely entire world. So we cannot now think only it's from Nepal and Jumla like that. It's the entire world is spread, and now we are in the facing of second wave like that. So COVID-19 pandemic, it's need to be understand. So I need to thanks to cause again, because this pandemic information is taking different kind of programs. It's support the health professionals, health workers, as well as doctors. And before pandemic, I want to say COVID-19 pandemic, I want to say something more, a brief history about pandemic. Brief history about pandemic means it is in 2020 we are in the facing, but 100 years back it's called Spanish flu. We say Spanish flu. That is a similar virus type. This Spanish flu also the same conditions, the same transmission to the human to human. There are many populations, the entire world population is more sick. So if you go through the understanding about that Spanish flu, it's not a Spanish, first of all the virus is not from the Spanish, it's for the everywhere spread, but that time due to the world war certain conditions, the country is given name as a Spanish flu. That time it spread everywhere. So that is called, that is a pandemic. So what that situation happened in the particular time of 1918-19, the same situation we are facing now. That time the population was very less and not globalizedly communicated everyone, not globalized moved everyone, but nowadays we are globalized, moved and communicated everywhere. So due to this globalization, we are connected with the world all part. So we are facing the challenges.
Yeah, thank you. Recently you talked about the pandemic situations, and as we all know that we are going through it. So what are the psychological consequences?
Before psychological consequences, I wanted to say certain challenge to the human beings. Generally, this situation will give social support system become dysfunctional. Suppose if I am telling now the society is the society is giving supporting for the human and relationships, as well as the organization, as well as the friends, circles, relatives. So many things will be happening. So now due to this problem and this lockdown, many things, the support system was totally dysfunctional. There will be no functioning actually. So everyone in everyone home, they are unable to meet the relatives, they are unable to go to their relatives' place. Maybe they might be in Surkhet, they might be in Nepal, KAHS. So we are unable to meet. It's kind of one problem. Another thing was we have the feel if we are going hospital. Even the hospital, within the hospital, maybe one doctor, maybe one health workers, one nurse, maybe they are working in the caregivers. They may get sick or die. So that the caregivers itself also have some problems. At the same time, anyone other person is meeting time, it will create the same problem. And this leads to what are the problem will come. It increases stress, because my movement was restriction and a very lack of resources, and I have so much of personal risk, and I have skill deficit. We can say skill deficit means I do not know how to this situation, how to use my knowledge and how to live my life. That's skill deficit. We are less. And sometimes we harming each other by the words or anything, and sometimes some staffs they have the intense workloads, and they have the child protection risk also. So they think about the child, how their child is going to be protected, this kind of problem. And further, if you want to say main in the community wise, if you want to say, as our Nepal, we are the migrated population, so people are working for the different part of the country. So now everybody was no job, so they started worrying about the deteriorating about the financial situation, and what is my livelihood opportunities, maybe forthcoming opportunities, that is not able to find it actually. Yeah. Oh. And now you asked some psychological challenges, everything actually. Further, it will be risk of harming others. We can have the it will motivate to the agitation. Sometimes we agitate what I can do. Sometimes suicidal ideas. Even if I hear the news that was in India, some of us very good actor Sushant Sharma, he has suicidal, so he did suicide, and many cases like suicide ideas used to come in the people mind. And another thing was affecting memory. So many stress create to the memory loss, and these are the things to again prone to relapse the mental health systems. And further, we cannot do this. We don't have the proper tools to control and resolve the problem. We are immediately addicted to the alcohol and tobacco and different substances. These are the problems used to come.
Oh. You talk about the problem challenges of the MSPS
and
mental
yeah,
health,
you that psychological consequences. Here I am coming. Psychological consequences is a totally different terms actually. It's a physical consequences. First, I can say physical consequences means pains and different acts. Suppose as a doctor, I'm a doctor. I'm just working in my hospital. So due to so much of work, moving here and there, and I'm taking certain different work loads, I get a body pain and different acts, maybe headache, stomach ache, and which leads to unable to sleep properly. It's created sleeping disturbances. It's not only from the doctor side, maybe staff nurse, health workers, and even admin side, any people should have the problem. It means the workload is increasing, the pain and different acts will come. That's for the physical. The next thing was emotional. Emotional means we can say emotional consequences generally by the agitation. So, and depression, sometimes I have stress, fear, I'll be sadness because I'm unable to meet my father. Generally, I'll be happy with every day in the evening, but I'm in the hospital. Like this kind of things will come. It's not only this emotion, not only the hospital, medical professional wise, even the community also. Because they not get a good business, and sometimes they're unable to meet their son, they're unable to meet their wife because I'm in abroad. So the depression, stress will keep on. That really emotional, psychological disturbances will come. And behavioral. So this emotional and physical, it leads to behavioral. Behavioral means you start refusing to obey the rules. It means you're not ready to obey the rules. Somebody say you should not go out. You will be interested to go out only. Then sometimes people say you should not do. You should wear mask. You should wash your hands, everything. Sometimes you're not ready to obey the rules. And motivating to do risk. What is going to happen? It's not. I'm okay like that. So it leads to some problem. And later I maybe add some information to you. And addiction. Generally, I started taking cigarette, tobacco, these things. And these are the problems will have the behavioral consequences. Then after that, if you want to say more depth in the cognitive wise, this is a cognitive psychological point of view. Cognitive consequences is more dangerous. That for misunderstanding. Suppose I am feeling the person have the COVID-19. If they're having cough, at the moment my mind will say he's having COVID-19. I should not look like that. It's not like that. And lack of intellectual about the crisis. I don't have what is happening exactly in my city. Maybe Jumla, what is happening? What about the Chandanath people infected means what is my area? Maybe ward number 3 or 4 like that. And some confusions. And I have some confusions about the real factuals and inability to solve the problem. It means I don't know how to solve the problems. Example, when it's come any cough and cold, what are the drugs I can take? Maybe immediate water, how I take. This kind of things will happen. And negative thinking and so many things. It's like so on. We can say the cognitive is one of the important. It's a mechanical tool. It will affect the entire our body and mind system. And next to us, social. If you want to say social, it's like a social means the moment I am just person to person. I'm just how I communicate with my neighbors and relationship. It has a poor adjustment and a loss of relationships maybe, and attention and care, and we can say hostility and blaming, and we can say the conflicts. So conflicts means generally my neighbors have come in my home. I'll immediately think why they're coming like that. Maybe the relationship been before good, but now I feel my socially I'm not capable of to handle the situation. And as a maybe youngsters, if you want to say isolation with peers, your friends will be different part, and you will be here. And this leads to what will happen. You want to meet your friends again. You want to enjoy that moment. So that will create the social psychological problems. And family and community. Generally, family before interacted with the teach function, and that now the community family programs is absent. So that will lead again social psychological some kind of stress will create, and some consequences keep on creating.
Okay. We recently listened to your views on common psychological misunderstanding and other problems people are facing.
Yeah.
Then, what might be the measures, in your view, in the medical professional view, what might be the measures having the MHPSS?
See, MHPSS means it's like a mental health psychosocial support. So in that psychosocial support, that is very important. So mental health is it's one of the average one. We not need to be discuss about now. That's a very different point. In the psychosocial support, if you want to say, we need to use the various strategies. So various strategies means we need to go as the first way. We need to consider the social consideration, the basic services and security with the effective supports. What is the basic services? We want to first know. First, this pandemic come, we need to wash the hand washer, and we need to use the hand sanitizers, and we need to use mask, and we need to take what kind of nutritious food I need to take, and food. And sometimes the community, as the hospital side as well as the administrative side, we need to provide the pamphlets, the awareness. Keep on how much we are aware about the things, the people will be more alert. And one more thing, I need to congratulate the present the mobile. Whenever if you're calling, we have the communication. Corona ka bata, the message is coming. So it's one kind of good initiative. This is the same way. It's by the audible actually. We need to next will be the picture view, in which the eye contact. Eye contact also we need to give the certain pamphlets, certain posters. It will help the people. And strengthening the community and family. So if you want to strengthen the community and family, you need to support increasing the health workers and coordinate with the clinical psychologist with innovative solution, increase the family networking and supports. So health workers need to be increased and coordinate with the clinical psychologist, means you need to be coordinate the clinical psychologist for the different programs and functions, and in the quarantine also, maybe they stay in the hospital inside as well as outside also. And some innovative solutions. Innovative solution means you need to encourage the people to work for the home, preparing the own mask preparation and own hand wash preparation. It will be more good. Yes, in this further MHPSS strategies, if you want to say, focused on non-specialized supports. What is non-specialized support means? The person have the not having any specialized education, so the person need to support the other person. If example one person have some information, some moral, some emotional support, the person can support the other person. And apart from that, very important thing was specialized services. Specialized services means we need to provide some specialized services. How we can, if example, the hospital can provide different entry door, outdoor door. We can keep the sanitizer. So keep on brushing, giving the sanitizer to the overcoming the inward person, outward person should be wash the hands. It will be minimize the spreading actually. So for this kind of idea, even the clinical wise, they have a different ailments in the patient, but once they're coming to the hospital, the clinical psychologist, psychotherapist and counselor will help a lot of things for this kind of situation. So the specialized services will support by the different ideas from the therapist as well as the health workers. We can create some new programs. It's not need to be like a previous program. We can create new programs instead of following the old strategies. What it's written, you just not need to follow, and creatively use the presence of mind. Like if you provide, it will be good actually. Yeah.
Thank you. And now, tell us something about common psychological problems and your views on common psychological misunderstanding and other problems.
Common psychological problems, it's very easy to tell you. Generally, if you look at the people, anybody have cough cold, they'll not ready to come for the hospital. So it's like avoiding to seek health facilities. And you are in isolation from family and friends. Your increases worries. Maybe I am unable to meet my friends, I am unable to dance with my friends, I am unable to study with my friends, like this kind of problem. And after that, you have to remain with the home a long time. You'll be helplessness, and you'll increase the boredom. Actually, you can see the loneliness. I'm not with my peer groups. I'm not with my relatives. I'm not with my sisters and brothers. So this kind of problem will happen. And another common psychological problem was loss of job. If you look at the maybe uncle, maybe your brother, maybe your father, the loss of job and work due to leading to the non-earning life. It means I'm not earning every day, but I'm eating food. So whatever my savings, I'm eating. So this kind of situation create every day the stress. What I'm going to do like that. And other things, if you're looking outside, oh, the people are infecting in the particular ward, oh, the country is infected this much thousands, oh, the people are dying from the developed nations. So this kind of misinterpretation of the COVID-19 and that knowledge sharing of information, it will increase the psychological problems and these things also. And what you said, psychological misunderstandings and other problems. Yes, in psychological misunderstanding and other problems, if I have very poor understanding about the mode of transmission, causing risk of being infected and infecting others. If example, I'm feeling if I wear the mask, I'll not get corona. That's one kind of phobia. It's that one kind of feeling creating everyone. It does not mean if I'm wearing the mask, I'll not corona. So one more thing, how I can use the mask and how many times I need to wash the mask, maybe I need to how to dispose the methods. These are things more important. Suppose I'm using mask, even I can say some of the houses I visited, they still after wear the mask, they're keeping in the home like decoration like that. So these are the knowledge need to be implemented from the medical professional side. So on the disposing method and the usage method and how many times we need to wash the hand, everything need to be teach by the psychological misunderstanding happening. It's there is one of the important problem for the hospital side. And suppose another problem, if you go by the family wise, the husband is working in abroad, so he's not able to return back. So staying alone with the children in the home, and it creates a lot of worries and lack of supports. Every day the husband will come 6 months once, 1 year once. Now they are unable to come, and these are the problems. The woman stress also will increase. Children's stress also increase. Every day the children not able to only talking phone. Before it will be job. Now there will be no job also in the country. So this kind of problem will create more some kind of psychological misunderstanding will create. And after that, if you want to say more, vulnerable individuals, older adults, and physical illness and mental illness. Vulnerable individuals, if you want to say, they are the adults. They have some kind of health issues, everything. So they generally before they will be physical illness very high. Now the mental illness also started increasing. But this time we cannot ignore our older adults and vulnerable people, because that is not a ethics actually. We need to give the care and affection with the right understanding about the social distance program. It will help the community as well as the other social psychological problems will be little minimized.
Yes.
Next.
Yeah. Then the next question is for you. What might be the psychological challenges from medical professional side, as you are a doctor, no? So.
As a psychotherapist, if you want to say, many psychological challenges in the medical professional side. Even now, the army is facing the situation, and it was less, I can say, than the doctors. Because the doctors and medical professionals, they face more challenges this time. Anyway, it does not matter. It is for the time we need to face the challenges, and we need to come out from the trauma, all the problems. So generally, if you want to medical professional sites, they have the workload. They will work for long hours shift. They will work for sometimes 18 hours, sometimes 20 hours, 16 hours. So it will create another stress. And another problem, updates of COVID-19 and serving and testing difficulties and other controlling areas. If example, one area was spread, it is community spread, and another contact tracing. So these are the things will be more heavy load to the medical professionals. It's a challenging one. Another things, if you look difficulties in taking responsibility of COVID-19. If, for example, I am not ready to take this responsibility, and if I take the responsibility, what kind of challenges will come in my side, like that. If, for example, spreading one particular village, a particular ward, how to control that responsibility is a more heavy task actually. And the contact tracing, you need to run where is the contact tracing and how many people you need to test, and need to the recent method of PCR testing and taking to the lab, because we are in the hilly area of Nepal, so one place to other place, going transportation. These are the very challenging things actually. And handling community spread, that is one of the things. If the doctors can be sitting in the hospital, so it's not possible to, community cannot control. The community is totally under the control of the CDO office and the police personnel, so it's not possible to handle the community spread from the doctor side. The doctor can be sitting in the hospital. Once the patient will come, they look. So this time they need to be, I can suggest it, this time they need to be coordinate with the CDO office as well as the police personnel and the doctors. They'll combine together work. It does not matter at the higher level, even the local level they can work together. It will be easy for the solve the issues. And concerned about the self-care and safety measures. Self-care and safety measures is one of the important thing. How I need to take care of myself, and what are the safety measures I need to follow. That should be more important for the doctors. Even I can say doctors are more aware. I can say healthcare workers, others. So for that, they need a safety equipment. Everything should be provided as soon as much possible. And information of long-term exposure. Suppose we should not think it will be only 2 months to 3 months. Maybe it's clear to understanding. The WHO said it should be going to be 1.5 years or 2 years. So it's a long time. So long time I need what are the strategies I need to follow. So this long-term understanding is one of the biggest medical challenge. I'll be going to work most of the time like 18 hours, 20 hours, the entire next 1 year. Not like that. You need to understand what is my schedule of the duties from the medical purpose side. and more comfortable and more easygoing method, and do some relaxation techniques, everything. It will create, further if you ask question to me in the time, I'll tell you further. Yeah, please.
Okay. Then how you take the medical professional stigmas and what would be the measures?
Stigma and the message. Yes, medical professional stigma means generally if I'm my doctor, if I'm a nurse, if I'm a health worker, I'm almost in the hospitals. I am unable to provide support to and my family and friends. Fear about my family and children, because every day I used to go evening 5 o'clock, but unfortunately nowadays I'm not able to go evening 5 o'clock. Maybe the duty time is increasing, that time my children who will take care of the children. This kind of problem will come. And one more thing, every time the mind will keep on think about the medical things, so it's not possible to give the support to the family. And another problem is discrimination due to constant interaction with the COVID-19 patients. If example, one jeep driver is taking the COVID patient to the hospital, then he get COVID infection, the another all driver should become a COVID-19. The COVID-19 prone to infect, like that. The thought will come in the community people mind. Even doctors also, health patients also, they'll be refused to interact with the particular doctors. It's happening, it's terrible. So it should be need to be understand. And negative reaction of surrounding community. So once the person is worked with the COVID-19, maybe the family belongs to the COVID-19, maybe the particular health person is affected by the COVID-19, the moment the community will be discriminations. And measures for this, if you want to say, the doctors need and health workers need to move with the protective equipments. That should be more important. And restraints from non-obeying rules methods actually. And sometimes if the restraints from the patients and the distance, everything should be followed. And vigilance, always I need to be vigilant myself. What is happening surrounding me and the hospitals, and what is the cleaning the method of the hospital, everything I need to be aware, and vigilance the hospitals, and check the sanitizer level, and maximum try to keep as an automatic sanitizer, maximum hand wash, right? Maybe that should be good for 20 days, it means 20 times per day if you are washing your hands, it should be more hygienic. And keep isolations rules and inside the clinics. If you keep the rules and regulations very strictly inside the clinics and outside the clinics, it's one of the very good measures for the medical professionals and the medical community. Yeah, next.
Thank you. And as we all know that you are a good doctor and you are a psychotherapist, we hope you have a good idea and good knowledge of people's psychology. So I will ask you, in your opinion, as a psychotherapist doctor, what would be the forthcoming or upcoming psychological issues and what would be these measures?
Well, this stigma about the survivors need to bring actually. For example, in my hospital, there was already infected person. He was recovered from the stigma. We need to bring this person. So we need to bring the person, keep the person, and motivating the person. So to tell how they're feeling when you're in the quarantine time, how in the hospital. So it will be less the problems, because future many cases will come. That time they should not worry, oh, if I go hospital, what will happen? No, once you are coming hospital, already the person came, he recovered. So it's not worried about what's the death or any sick and all. This kind of things should be clearly explained to the community. So this for the we need to bring the stigma survivors already actually. And social isolation and decrease social networking. So we need to create hereafter social networking, keep on meeting together, mass gathering, and should be stopped, and increase the social isolation. It's like now curfew, whatever they're doing, we make the social isolation. It will be good. At the same time, the psychological problem will come. One, we will be ready with the strategy, and that strategy, if you apply it, most of the forthcoming problems we can handle it. Another thing is, once I'm in the social isolation in the home, I have the pent-up feelings will be more high, pent-up emotions. So that leads to violence, and we need to address the immediate pent-up emotion. Suppose once the person having some kind of things, we need to first release the pent-up feelings. So it may be I have fear about COVID-19, either I have fear about the hospital, either fear about my death, either fear about my education. Everything should be released once we are receiving the patient. And misconception and mistrust, rumors actually. If you want to say misconception, they have the conception about the COVID-19. That's not like that. It's like one virus. We have a good immunity. We can come out, like that idea. And rumors, somebody will say this place where people died, this place people was so many sick, like that will happen. That rumor should be prohibited. and when we want to be locked down, when we want to opening, and when we want to outbreak, curfew. This everything should be good planned. So these are the planning should be good. It will not affect the everyday life of the people. The people will be comfortable with the social distress, social situation also, and at the same time they can handle their life with peace and security. And another thing was relapse and negative outcome. If you want to say relapse and negative outcome means it's suppose I am checking once corona, then after I'm coming to find some other body organ problems maybe. So these are the things we need to be addressed properly. So these are the forthcoming problems. So we need to be addressed properly and handled properly. Yeah.
Yeah, you already talked about the measures and studies of many, but I want to ask you especially for particular group area. In your view, what might be the special measures in the context of underdeveloping countries as a cultural view?
Actually,
Like
here we need to be Nepal. If you want to say, we need to get everybody we know speak only Nepali. It's not in English. Now I'm speaking this interview. I don't know how many people can going to be understand actually. But anyway, I come to the point. And Nepali language is more high. So we need to be WHO, whatever the guidelines need to come out to Nepali, and we need to give the WHO give the exact communication information to the give the information to the people, and need to provide the guidelines. So this will be more good actually. So they need to get a right information. We need to post the right information actually, and we need to give the schedule and routine. It means you need to create a schedule and routine and follow the routine every day. That schedule should be morning, wake up, and evening. This kind of thing should be giving. It will be more comfortable. Now the scenario is changing. So now the doctors also, as well as the medical, everybody should be come forward to work innovative ideas and engage in family activities. Once you are in the social isolation, you need to be engaged with the family activities, doing your carpenter work, cleaning work. Maybe you are making supporting for the kids, everything, and maybe you can relax. This is for the time for relax. You can relax yourself, and you can read your books. And it's not only for the community. The doctors also can time for whenever you get a time, you can read the books, and when you are in the hospital as well as in your home, and educating children. Now the schools are closed, so you can educate the children and. Don't tell the children about your own myopic view about the crisis. So tell about the positive things. These are the things happen 100 years before also. It will be changed. We need to be positive like that. We can say like that.
Yeah. Sir, tell us something about special strategies and measures in the context of underdeveloping countries like Nepal as a cultural way.
See, underdeveloping in this context, if you want to say underdeveloping and developed, it's all nations, even developed nations, US also facing these challenges. So as far as if you want to say Nepal concerned, we need to be proud and we need to be happy with the condition, because we are the only country natural boundaries with good mountains and high peaks. It's helping to the people from this corona situation, as well as we have the good oxygen level and natural environmental condition is providing good asylum. And cultural point of view, if you want to say, we are the, maybe I can say Nepal can do many roles to the world. That's my observation, because Nepal is the only platform for the many saints and the rishis, especially Buddha was born this place, so he taught many teachings. So I can say in this strategy, MHPSS Strategy and Solution, meditation is one of the important strategy. This meditation, especially Anapana meditation, it was taught by Satyanarayana Goenka ji in India. And before this technique, Anapana plus Vipassana, this Dhamma teaching, everything done by Lord Buddha. So the Gautama Buddha was birthplace. So we can use the meditation, because a meditation is not only for that, it's like enlightenment. It's meditation have the so much of scientific information is there. Even if you are meditating in the morning, early morning, 4:30 to 6:30, that time your oxygen level will be more high, as a scientifically proved, it will be 100% oxygen. And if you are doing that Anapana meditation, it will increase your antigen level very high. Even your telomere level will be increased, more productive, and you have more empathy. Maybe in the next slide, if I have time, I will show the information further. And yoga will help for the boost your immunity power. And other exercise, it will increase your muscle balance and body, and it will give more psychological benefit as well as other medical benefit. And if you're going deep breathing exercise, special workout according to the ailments, the counselors give. Maybe suppose some deep breathing exercise need for some people. Sometimes for asthma patient not need to, it needs some counsel support. If you are working the deep breathing exercise, it will help more expansion of the lungs, So it will provide the alveoli as well as the oxygen taking hemoglobin content. So it will be increased naturally. So for the biopsychosocial field I am saying. And apart from that, develop hobbies. We have a culture of craft works in our Nepal, so we can create many craft work related things, flowering pot, and we have that very good songs are we have in Nepal. So we can do many singing, cultural dancings, maybe Baira Chowk, Chaudhary dance, many dances I know a little bit. So drawing, different drawing art, and if you make a rangoli of our traditional rangoli, so this will make more happy and more enthusiastically in your life. It's good. And apart from, it's very important, eating nutritious food and fruits and taking important other immune supplements. For example, local vegetables will give them more whatever the vitamin A, D, this entire things available there. And apart from fruits, we have suppose in Jumla we have so much of apple, and we have different banana, everything we can eat. And taking important other immune supplements means you can take basic protein related foods. Example, simi dal we have plenty of available, and we have the marshich rice, that is one of the vitamin B12 B6 rice, so it is good for the good vitamin content. Not need to worry about I need to take so many downic and not really. If it's very sufficient for this. Actually only thing we do not know this is available or not, we do not know. Further, the strategy, if you want the solution, we need to be always positive, and we should not think about the worry anything. Sleep well, because now we are in more good than compared to other part of the world. So we need to good sleep well and early wake up. Early wake up, it will help for the natural immunity level automatically increase. And socializing, make phone calls to your friends, and not need to be direct contact. You can make a phone calls, and you can have social media, and for the right knowledge purpose, rather than should not addict to the mobile electronic gadgets. And indoor games, it will be more good, and other creative innovative things should be need to be explored. What are the ways I can play within the indoor games, without touching others, how I can play, maybe clapping games, many things are there. So you can find with these ideas from the counselor, psychotherapists. They give them many information, so it will help the people as well as the community, doctor, healthcare workers more balanced and equanimous in their day-to-day life. It will help recover from the situation very fast. Yeah.
Thank you. And one next question for you is, what do you mean by MHPSS strict measures?
This means the mental health and psychosocial support. If you want to do it, you need to follow certain strict measures. That is the point, means you need to false information, especially something they are saying this much case, and the person is went one place, that time get infected, he touched their father, infected. Not like this kind of false information, rumor should be very strictly prohibited, because it will create more discrimination, more social bias will happen, and risk-taking behaviors. Okay, let it go, my father is policeman, I know this person, I can move everywhere. Not like that, should be very strictly, moving out should be stopped. Refusing to the following rules. Sometimes they'll never ready to follow the rules of what the government saying, what the police person saying, just refusing. That should be one of the important things. You need to prohibit it very quickly. And social isolation with the proper program and measure should be important. So once you are in the particular curfew time, 14 days, you make your own plan, and you can maybe according to the MHPSS, the medical professionals as well as the government can give this different kind of programs by the NGOs, health professionals to the community as well as the school children's peer groups and so on. And stick to social distance and prevent mass gathering. That's very important. Social distance still we are lacking every time, because we are thinking it's like a bandh, some kind of strike. So after curfew open, everybody is mixing with each other and touching other, and mass gathering, and appearing without safety equipment, sometimes without mask, and without not using sanitizer, not taking sometimes bath very long time. So these are the things. And another thing was alcohol, drugs and tobacco is called kind of photocopying, we can say. So this kind of method should be strictly prohibited, because alcohol, drugs, tobacco decrease your immune power. Once you infected, you get again more problems. So that should be prevented. And some kind of need to be prohibited the misconduct behavior, and whenever you are finding in the society and environment, you need to be stop it. Otherwise, it will threaten the maybe women as well as the children's community. So we need to be strict. These are the strict measures need to follow it. Yes.
And the measures for the children. What might be the measures for the children?
You're asking children. Yes, children's we want to say thanks to God because we are adults are infecting at the same time children still now it's not infected case. So that's the one important thing. And risk of infection, maybe they have the risk of infection, they may be carrying the virus but they may be not harmed. That may be the chances. So we need to teach the children 6 feet distance and model of information and demonstrating the safety measures, how to wash my hand and with 20 times every day, how to use my soap, how to keep my soap and kerchief, how to throw the mask in the dustbin, everything. And always make sensitive with the kindness. What is happening or surrounding the environment, you make the sensitive to the kids. And tantrum and irregular routines should be avoided. Should we make the schedule of the day and spending time with children and educate relevant subject with importance to moral teaching actually means how to behave, should not say lie, and the other thing was teaching certain important valuable stories. These are the things that will help for the kids to improve their communication as well as other things actually. Next, it was difficulty in expressing creative activities, positively to express drawing, gardening. So the kids can do the drawing work, gardening work, and as well as for the creative works. This will help for the things. And after nowadays, kids are mostly engaged with the electronic gadgets. So the electronic gadgets, it's diverting the kids more addicted. Once if you remove the electronic, the kids will get more anger. So instead of that, you can better divert the kids from playing games with electronic gadgets to the physical games. Control appropriate usage of electronic instrument and the procedures need to be followed. And specifically, parents should not addict to the electronic gadgets. That should be a very good thing for the kids. Yeah, and yes, that's all. It's for the children. It will be good for the children. Yeah.
Then recently we talk about the children. Then what might be these measures for the elderly people, citizens?
If you want to say elderly people, now the present problem mostly most prone attacked by elderly people only. It's not any other people. If example, elderly people are more physically already they are weak actually. Even mentally they may be a little bit weak, but the immune system very less. That is one of the reasons. That should be need a clear understanding. So for that we need to provide a residential care. And we need to give what is the infection about the COVID-19, and the panic and worry should be resolved by safety and supporting measures and prevent the infections. What are the ways they can follow everyday day-to-day schedules actually. And apart from the vulnerable immune system, they need generally elderly people, they need a medical supports, especially for they need a basic BP drug or maybe heart related issues, stomach related issues. They have some problems already, vulnerable immune system related problems. So for that we can use the modern technologies, use the telemedicine, and especially in Nepal we have the remote areas. They have the one mountain to other mountain you need to travel. So instead of the use of the health workers to the remote delivery system. So this will prevent the elderly people carrying this spread should be it means minimized. As well as the elderly people should be preserved also. That's in preserving the elderly people community should be safe and care. It will be maintained very long time. And the limited use of communication, it should be more important. Supporting phone calls and recent development app will help for the elderly people. Suppose the father want to talk with his daughter or maybe son, it may be from the other place of the place. So you can develop the app technology from the local health workers. Maybe any person maybe can help create that app. That app can be talked with the facial appearance to the children, so it will be more satisfying the elderly people. So less spread for this COVID-19. That should be one of the things. And other psychological issues, if you want to say, some people have the dementia, they have the cognitive decline, and sometimes suspicious, agitated, right and clear and confirmed news and issues. Sometimes they do not know this is the root, this is the true, this is the untrue. Sometimes they are suspicious whether there is problem or not. Sometimes they generally agitation. So these are the psychological issues we need to handle properly. And what is the exact problem? What is the history of the patient? Everything, if you know, it will be easy to advise and clear the problem and support it very quickly. Yes, next.
Okay. Then specific measures for the disabilities people.
Yeah, mental disability people are the very critical one, because now you are good in communication, you are more aware, but at the same time mental disability person cannot understand what you are saying. So there will be lack of communication, And so when you are lack of communication, they will not understand the COVID-19. Generally, they'll come and cheer with you. So once they come and cheer with you, they have a chances. Maybe I saw one situation in Surkhet, there was kids moving everywhere, don't know how to wear mask because the mental disability was so high. So this type of situation, transport access for mental illness should be stopped, and illness people, any mental illness people should be prevented. And we should be avoid stigma towards the mental disability people and prejudice. In better we can handle properly with love and affection from the distance. Making with the distance, we can give the love and affection care, and using the gesture something, it will be good for the disabled children, the disabled people. And managing methods, access to the communication. Maybe they can use some mobile communication. Maybe in the hospital, you can use the communication by the electronic ways. We can communicate the people and give the continuous support, even if the distance, give the telecommunication support. And planning strategies and linking the community, it should be established. Strategies should be for how we can work on. Maybe there are more number of mental disability in the particular area. What are the strategies can follow? And linking the community means the particular community, maybe the healthcare workers community, make more knowledge in this situation how to handle it. That should be more important. Yeah, this should be for the mental disability people. Yeah. Next.
Now you talked about the disability people, children, and elderly people. Now I want to ask you. This is the pandemic period. So, what would be the special suggestion for the quarantine people there?
Yeah, quarantine, that is a very important thing because everybody is now not infected like the situation, but quarantine was infected. We are certified with people. So generally they have the challenges because they face separation and restriction of the movement of the individuals who are potentially exposed to a contagious disease, to reducing the risk of them infecting others. So generally we should not, we need to create some kind of programs, especially if they have the fears of infecting and sometimes frustration not to meeting their family members, boredom, keep on staying in the one bed and not moving, not able to look the environment outside, and inadequate supplies. They used to enjoy with in their life. Now they'll be not having only food and bed rest, so they will be there. So for that we need to give the, already I said, meditation, yoga session and dancing session, many different things. If you do it, they'll be more happy with that thing. And post-quarantine clinical works, it's more important because returning to the schedules, once after they'll be recovered, they're going to the home, we make a schedules, what is your everyday duty, because there'll be a lot of chances to infecting again. We need to make a schedules, and what are schedules you need to follow it in your day-to-day life. And counseling to the financial issues, we need to give the counseling for their problem, because 40 days they are here, 30 days or 1 month. After once they are going back, again should not be depressed, because again depressed, again there will be more chances of health multi-organ failure, many problems will come. We need to give them how to make their financial conditions. And stigma about the society, maybe the society will think he is a corona person, he was admitted in a hospital. Like this kind of stigma should be how to face how to handle the situation, the patient in their own village, and connecting community and prevent the community discrimination. If one person is coming from corona ward, the moment the entire village never look the patient, actually never look the family, never contact, even they will make a discrimination. That should be removed. It is not possible to teach that community better. We can teach the patient. It will be happen maybe 1 month or 2 months. Once you start and mingle with the society, you start and keep on working, the people will forget. It is naturally you will be interact with the people. So this is the way the post-quarantine clinical work is more important. And once inside quarantine, we have already WHO guidelines that should be, and other entertaining program, everyday schedule and routine shift is followed. Is good for the quarantine. Yeah. Next.
So I'd like to inform you that we are at the end. Till now we discussed about the consequences and the different strategies, stigmas of the MHPSS. Now sir, finally at last I want to ask question you, wants to know your views, final opinions or final words for all at the concluding.
Final words for all, I can say awareness about self during the crisis. And again I'm repeating the same things. Identifying the stressful situation is more important, whether it's behavior or physical or emotional or cognitive or social. If example you are in the health post, the village person is coming with a physical problem, maybe the mental, in the body pain, maybe the headache or stomach problem, it's a physical. So we need to understand immediate attention how to, this is a stressful situation, what kind of stressful situation they're facing. behavioral. They don't want to be stay in the home, they're moving away, not obeying the rules, and agitation. So this stressful situation, if we identify it, is a better, good treatment, not getting any violence with the community or society. Even it should be in the doctor field or in the academy as well as the institution, organization, anything. Whether it is a cognitive, in the intellectual understandings and thinking, fear, that should be understood. The identifying the stressful situation, it will give for solve the problem very quickly. And appropriate clinical strategies and solutions should be more important to rehabilitate this situation. And finally, if you want to say, coordinate with the clinical psychologists and doctors, consult, support senior experts. So this will be more important. So there will be more experienced people, whatever the field from the people they can support. We can minimize the problem. That is one of the important, my final words. And manage the victim with the help of biopsychosocial knowledge. Apply the strategy of MHPSS. It will reduce the problem. And one more thing, the spread is, it's mainly, as far as my many researchers I find, even 1918 cases, the present cases, it was mainly by the malnourishment and poor immunity and very poor hygiene. So our doctors as well as the psychologist community, all other departments, if you focus on the immune system by giving the good nutritious food things, and malnourishment should be removed and hygiene level should be increased. So every day cutting hair, nails, and taking bath and armpit cleaning, and after that changing clothes and washing clothes, many ways. We have many, that's a separate lecture I will give you. So this everything, if we give it, it will be more good. So it will be come out from the situation very quickly. That's all. And be safe, be aware, and be help others without discrimination, and be happy. And do meditation. That's very nice suggestion. Do meditation. Meditation will make more equanimous in your life. And once you are equanimous, no disease will attack. Even disease will attack, you're more happy. Yeah. Thank you so much.
Thank you for your time and energy, sir. I would like to inform you also that it's my first YouTube video.
Okay.
It's my first time I interview you. And thank you, sir.
I really inspired. I am very pleasure to, as a youngsters, you are with enthusiasm you are doing this work here. I am really inspiring you, and I keep in touch with this YouTube channel. And further interviews, further information I'll give you. And I want to thank this moment, this electronic challenging, that's a network challenging situation. You prepared this video very short time, or within the day. So now we are going to give this video to evening. So thanks to Mr. Milan starting the YouTube channel, as well as the helping other person, Mr. Subhas also. Thank you so much, and thanks to COVOD. Use this video for whenever, and if you need any communication for me, and my number, my mail ID is there, you can please communicate and contact with me. Thank you.
Please, all of you guys, like, subscribe, and share my videos. Thank you.
Thanks.